Thank you.
Okay. Well, let's start this meeting. Welcome everybody. This is the Children and Family Overview and Scrutiny Committee. I'm Andrew Miller. I'm chairing this meeting. Over to you, Andrea, for apologies.
We have apologies from Lorraine Patrick and apologies from Alan Priest, and Councillor Phil Orford is substituting for Councillor Priest. We've also had apologies from Andy Dempsey, one of the officers who is unable to attend today.
Andrea, declarations of interest. Do we have any declarations of interest here? I'll take that as.
Can I come in and just declare an interest? I've already got my business down, Pumping Station Limited, as an interest, but in August we opened a holiday accommodation for people with disabilities, and as we're talking about people with disabilities later on, I just thought I'd mention it as an interest.
Right. So it's at the previous meeting, Andrea. Andrea.
Oh, sorry, I thought I'd unmuted myself. Are members happy with the minutes from the previous meeting? Everybody looks happy with them, so is it okay for the chair to sign them virtually? That looks like everybody's thumbing up, so we're good to go.
I virtually sign them. Now, education and COVID-19, this is a very important topic. It's about looking at the arrangements that we've had for our young people during the COVID period. So I'd like to hand over to Charlotte Jones. I assume Charlotte's on the line?
She doesn't appear to be here just yet.
No.
Chair.
Well, do we have school on the line?
No.
Right.
You do have me, though, Chair, as Director of Children's Services.
Right. Okay. Would you like to speak to either of those items?
Yes, thank you. Thank you. I'm sure Charlotte will appear at some point. She's just been in the corporate gold meeting with me, so she is here and present, so to speak, maybe just not logged on. So the problem I have is I don't have the papers in front of me, so this is going
Sorry, I hate to interrupt, but Charlotte is just joining the meeting.
Okay, so Charlotte, are you on the line?
Yep, here.
Okay, so we're just up to the point where I was just about to introduce the item on education and updates in relation to the impact of COVID. So I'll pass over to you. I haven't said anything yet. I was just about to start with the structure of our weekly meetings, daily conversations, react meetings and so forth. So I'll pass over to you. Thank you, Andrew. Thank you, Chair.
Charlotte, thank you very much for joining us, and we're very much looking forward to your report on how our young people have been getting on at school and education during the COVID period.
Yeah, thank you, Andrew. Obviously, you've had the reports being circulated, so I won't go into it in detail. At the end of this, I will just want to give a brief update on where we are now as schools have returned in September, so I'll probably concentrate a bit more on that. But as Chris implied, since February, we instigated probably daily conversations with head teachers at the time for our associations for primary, secondary, special school and the diocese, just to start seeing what the issues were from schools, and also then enabling us to respond quite quickly to, particularly initially, some of the early on, some of the mixed messages schools were receiving, and having to deal with the plethora of information coming from public health, from the DFE and other sources, and trying to get to a point where we were helping them unpick what's important, have that local context, and try and achieve some consistency around the county, particularly as we know our families are served by a number of different schools. I think that's been hugely successful the head teachers on that group have remained stable, and we're having conversations now about how we can continue that really close working through COVID and into kind of our normal business as usual, really. So I think there has been some real strength in having that chance for those kind of informal debates rather than kind of a structured agenda, and really hearing what's going on the ground and how we can support that. Set the report into a number of different phases, given that it seemed like every time we kind of got ourselves stabilising education, another government announcement changed the direction that we were going in. So very early on, schools very quickly got used to only supporting children of key worker children and vulnerable children. We did see back at the kind of beginning of March, far more key worker children taking up their place than vulnerable, which I think is probably to be expected when we were looking at the challenges with the NHS at the time, and those key workers really needed to be remaining in work, whereas a lot of our vulnerable families were working from home or were furloughed, and actually kind of made their lives a bit easier in terms of managing their children. But over that initial period, we saw vulnerable children increase. We undertook a huge exercise with all of our children with EHCPs and all with a social worker, so about 7,000 children in total, in terms of a COVID risk assessment, to really understand those children who were probably better off in school. So having those conversations with parents, with schools, with professionals, to actually understand the potential risk of infection for a certain number of children compared to the risk of the family resilience being at home for prolonged periods of time and not having access to either the same kind of social experiences and peer groups that they would have had, or for some of our children with SEND, the same level of provision that they would have had in school and receiving that. So we were in a position where we could then tackle those families where we knew children probably would be better off in school and have a far more informed conversation. And that's where we saw the number of children then returning to school from those vulnerable categories increase over time. We had daily attendance data from the DfE to help us unpick that. And obviously there was always kind of dips and trends in that data. We also had our schools open over the April and May half terms. And again, we saw smaller numbers of children then coming through that. But all through the period, and particularly that first phase, we were well above the national average in terms of school population. So we had just under 4% of our school population in school, in average, 24% of our vulnerable cohort. And we saw that, as I say, increase over time. So from the first day of lockdown to the end of May, where I think some of our families felt the need to return their children to school, also the work that we had done with our vulnerable children. And I think also that increased confidence that schools were managing the situation well. And I think all the way through kind of phase 1 and phase 2, we didn't have a confirmed case or spread of a case in school. So again, I think that gave parents confidence that schools were managing things appropriately, and actually it was a safe environment for their children to be in. Then obviously from the 1st of June, we were in a situation where the DfE announced that schools would start to take more children. If I'm honest, I think that put a lot of pressure and additional burden on schools, really trying to unpick the DfE advice, and then the expectation from all families that their children would then all go back to school full time and everything would work for them. The challenges that we had in our county with, at that point then, the growing number of key worker children taking up their school place and the increasing number of vulnerable children meant that not all schools were able to safely have those bubbles of 15 children and take all of the children that the DfE had asked them to prioritise, which ended up in some inconsistency across the county based on school capacity, staffing and numbers of children. I think some parents struggled with that, but I know every school pulled out all the stops and did what they could. I know a number of schools across the county also took steps to make sure that every child could at least return to school for an afternoon or a day to see their friends before the summer holiday, and for schools to have that connection with children. So I think schools did an amazing job in terms of supporting that. Secondary schools were slightly different in terms of only prioritising those year 10 and year 12 children. But again, they had to make sure that no more than 20% of their total cohort was on site at any one time. And again, that fluctuated then between the offer that they made for those children who needed more support and those who were actually coping very well at home, and probably more of a well-being aspect and picking up those children who were struggling academically with that learning at home. And again, through that phase, saw significant numbers of children in school, doubled overnight, and schools coped really well with that, and also having to make far more robust arrangements in terms of those kind of COVID safe measures and one-way systems around schools, extra cleaning, hand washing, all the other things they had to put in place. So you know, the numbers are in the report, so over 18,500 children in total, so almost a quarter of our whole school population managed to have education in those last 6 weeks of term. Majority of our reception year 1, year 6 children, they all received education in that last 6 weeks. In terms of the data, the kind of the half proportions there is showing that most children were given a part-time timetable to come into school. So where you had a class of 30, schools were offering half the class in first part of the week and the other half the class in the second part of the week, to make sure everyone could access some education and have a benefit in that. So every child then received that education. Again, as part of that, schools had to continue to develop their remote learning offer, which many have done tremendously well in. There have been some differences across the county, and I think prior to lockdown, schools were in different places in terms of their own technology and their own systems, but immediately from the start of lockdown, schools were sending work home, however that looked like and however that was appropriate to their children. I think what we saw in phase 2 is the teachers who were had capacity in the initial stage of lockdown to provide the online learning material, all the material to take home. Once we had classes full of children, there was that balance then of teachers having to stand in front of classes and teach them and provide those online learning resources as well. And that was one of the reasons why the DFE commissioned Oak Hill Academy nationally. So there was that position there that schools could use that provision and then enhance it with their own offer, rather than having to develop everything from scratch. And I know a number of our schools in the county use that quite successfully. Another thing that the DFE offered was laptops for vulnerable children, so those with a social worker and those in year 10 who were receiving free school meals. So one of the things that we had to play in the local authority is facilitating the ordering of those, and then the check-in of them, that they were working and making sure they were secure, and then sending them out to those children who needed either a new device themselves, or actually something that they could use far more productively then for online learning. And we had a number of cases where children had been learning on their mobile phones, or siblings were having to share laptops with each other to prioritise their learning. So that obviously has helped some of those children. And I'll talk a bit in terms of what that means for September as well now. So schools did do a lot of planning for September. Unfortunately for most schools, that had to be over the whole summer holiday period due to the lateness of guidance. And I think heads have done a tremendous effort to get things ready for the wider opening that we're now in. It has meant a complete change again to the arrangements that they'd put in place to take all of their children into school, and making sure that their staff that they've had shielding as well in that time feel safe enough to come into school. And I know some schools have had to manage some quite careful discussions with staff around the risks of that and how they can manage the risks of that. We've also had to put a lot of support in around transport to make sure that every child who needs access to school can do so in a controlled way, not necessarily the 2 metre social distancing, but making sure all the other systems of control are in place around bubbles and extra cleaning and forward facing and managing that. And we've put an additional 20 vehicles on the bus network and far more in terms of taxes to help us manage that successfully. The government have given us some funding to cover some of the costs of those, and we're currently in the process of working out exactly what that is costing the local authority to make sure we can make best use of any DFE funding. I think we've dealt really well with any issues as they arose. But again, now we need to make sure we've got capacity in the right place. One of the things that schools are being asked to focus on now as children return to school is that well-being aspect. You know, children have been out of school for some time and will have very different experiences around that. So we are providing through our educational psychology service training that improves on the offer that we've got currently through our Gloucestershire Healthy Living and Learning team and the Mental Health Trailblazer, to make sure that we really upskill staff in terms of understanding some of the trauma children have been through and to help them with their mental health and well-being. And that training will be delivered through September and October, and that invitation will be going out to schools shortly. And we've also worked with the CCG to commission a number of surveys. So we had a separate Year 6 transition survey to see how Year 6 children were feeling about going into a new school in September when they've missed out on their normal transition. Some really good things came out of that were sent to the schools where those children would be attending, and quite practical things like, can we have a map of the school? Can you buddy us up with somebody in the school, or let's meet our teacher first? Those kind of practical things that you would have done had you been able to put those transition arrangements in place. We've also commissioned a lockdown survey for children from Year 3 to 13. We're getting the results of those in the next few days. And that again will help us understand where we need to support schools and target those children who have really struggled through this period. I think what we have seen so far is a particular increase in mental health of girls and boys, but probably girls more particular, in kind of Key Stage 4, where I think the whole concern around GCSEs and what the examinations will look like has added a bit of pressure. So I think there'll be some targeted work that we'll need to do there. We've also been working across children's services to identify those children who we thought would struggle going back into school, and what that would look like, both on a team around the cluster approach and those intervention circles where we work internally to make sure we're supporting children. We did a particular piece of work with our, sorry, if you can hear that in the background, there's some drilling. Just a particular piece of work with our children in Year 11, particularly concerns some schools because of the lack of engagement then once that cohort knew that they weren't going to be sitting their exams, and the concern then that they would become NEET before this college started up again in September. So we've done a particular piece of work with that cohort, and I can say, obviously, we're still waiting for some of the colleges to open up all of their courses for children, but at the moment, 81% of those young people have started attending college. So I think, again, a success in terms of that multi-agency approach around that. Schools are having to focus on offering the broad and balanced curriculum, which kind of is the school's core purpose. Schools have made great efforts to look at recovery curriculum, post-COVID curriculum, to make sure they help children with that catch-up element, and the DFE is making some funding available to schools to help them fund some of those different programs that might be, but also making sure that really doesn't help them focus on some of their GCSE courses in Key Stage 4, but also picks up some of those health and wellbeing issues that they'll need to get back to where they were to enable them to make that academic progress. And I think probably particularly in Key Stage 4 and some of our Key Stage 1 arenas, we have seen schools not being able to put all those safe systems of control in place, such as in a reception class, you might not necessarily have all forward-facing desks because you'll miss that social interaction. You might not be mixed, you might mix bubbles slightly more in Key Stage 4 to make sure children can access their own GCSE subjects. So that, again, there's that mix of making sure that children have that access to the curriculum whilst maintaining safety as far as possible. And I think schools have done tremendously well at that. Schools do have to report every day to the DfE on their attendance. We know that not all schools are doing that at the moment, and not all schools are doing it consistently. So we've got probably about 28 schools that we're having to follow up there, but the majority of our schools are reporting, and we know that on last Friday we had 90.5% overall attendance from the 254 schools who submitted their data, and that's 87.5% from children who have an EHCP and 87.6% of children who are open to social care. And that's between 9 and 10% higher than the national averages in all those categories. So actually, I think no schools in Gloucestershire have done tremendously well in supporting that. Last year, in the whole of the autumn term, our average attendance in the county was 95. So at the moment, we've got no reason to believe that under normal circumstances, we wouldn't be at that same level. I think what we're starting to see this week now is where we are having positive COVID cases, and we have now in a couple of schools. 2 of those schools have had to send bubbles of children home. So we know we've got probably about 290 children who are having to self-isolate, and because they've come into contact with a child in their group, that they'll be receiving the remote learning package that schools have to put in place, and any vulnerable child, the local authority will be supporting in that. But I think that's where we'll start to see some of that attendance variation now, as we start to see those peaks and troughs happening. And we've had a conversation this morning around some of the delays in testing and the impact of that on education. One of the concerns that we've had nationally has been due to kind of the anxiety of parents sending their children back to school, particularly in families where children have been self-isolating, or parents or family members have been self-isolating, some reluctance to send their children back to school. So we have been anticipating a higher than normal increase in elective home education. Last September to October, we had 56 new children coming onto the register during that month. In the first half of this month, so in kind of half that period, there's been a net increase of 110 children, so significant increase in home education, predominantly from parents who are advising that they are taking this measure temporarily until they feel that kind of COVID has passed. I think there's a debate there we need to have about when that is likely to happen. We are talking to schools about how we manage some of those parental anxieties. It's a parent's right to home educate their child. Once a school is told by a parent they want to home educate, they have to remove the child from roll. But what we are encouraging every parent to do is have a conversation with the school and the local authority before submitting that in writing, to talk about their concerns and anxiety and see what we can do to mitigate that. We also know a number of children, and particularly those who are anxious, school phobia, have actually thrived in a home learning environment. So we have now had a few requests across the county for flexi schooling, where children will have a mix of home education and some education in schools. And schools have been quite accepting of that to make sure we get that balance right for children. The DfE did advise that from the 1st of September, schools would be able to put back in the punitive measures around school attendance for families who weren't doing so, so the kind of the penalties for non-attendance. We've worked quite closely with our schools, and we had agreement with all of them that we wouldn't seek to be doing that, at least for the first term, if not the second, where there was real anxiety. Mainly because we didn't want parents just to completely remove their children from school, and we wanted them to feel that they could have that open and honest conversation and see how well the schools were managing the situation to start to bring some of those children back in. So from a local authority perspective, home education particularly is something that we are monitoring on a daily basis. We haven't seen any trends yet, so it's children of all ages and from all districts. And obviously we would normally have a number of children in September decided to become home educated anyway, but it's that increase that we're particularly worried about. And alongside that, we are assessing all of the attendance data for our vulnerable children particularly. to make sure that between social care colleagues and education colleagues and schools, we encourage those vulnerable children to be attending school regularly, and again talk to families about their concerns and how we can mitigate that. And also then taking a more school-based approach and looking at those schools who have lower attendance than they normally would have, and that isn't specifically related to kind of COVID classes isolating, to really unpick whether there are kind of school issues that we need to be help support them with. And at the moment, I'm having daily contact with the RSC to escalate any concerns with academies, so we can take that joint approach. And in addition to that, I meet fortnightly again with the React team to make sure that we can be addressing those issues and see what we can find going forward. So I think the current issues that we have, I think, are quite small in comparison to the situation we find ourselves in from an education perspective. So the arrangements are working really well. There have been some small issues with some schools around parents' inability to want to social distance before and after and outside the school gates, and that social responsibility from everybody, and schools have worked really hard with their communities to help do that, and we've been obviously managing those messages in the media as well to help with that. We do know for some schools the issue around testing is a particular problem, and the delay there. Obviously schools where they have asymptomatic teachers, they want them back in the classroom as quickly as possible. So as a local authority, there's been lots of conversations with Director of Public Health nationally to escalate the testing issue. Locally, we have had contact with the NHS, and we've secured the ability for teaching staff to be tested at the Pillar 1 site in Brockworth to help schools then manage their teacher capacity. One of the things from the DFE ahead of September reopening is there would be no additional cost to schools in reopening in September. Previously, schools were able to claim back kind of COVID-related funds. So it is something we are escalating on behalf of schools nationally in terms of teachers being off and potentially much higher supply costs for schools that could have an issue on their budgets going forward, and how they manage that. I think kind of the other noise in the system, obviously this time of year, is where parents of Year 6 children start to think about which secondary school they're going to apply for by the end of the month. We have advised secondary schools and primary schools to that extent not to hold their usual open days and open evenings, purely because they've taken so many steps to make sure their site is COVID secure for their staff and their children. To open their door to significant members of the public is going to completely detract from their work. So many schools will be offering a kind of a virtual environment, virtual tours, online discussions to host those slightly different ways of kind of attracting children and helping children understand where they might want to go in September. We have had a couple of confirmed cases in schools. We do work really closely with Public Health England and our local health protection colleagues to make sure we're giving the right advice and guidance to schools. The DFE are also asking for the same information, so we are working out a way where we can streamline information going to the DFE and retaining locally, so we can make sure we're giving schools the support that they need to manage those cases effectively and have that right level of information and support. I say at the moment, the start of the term's gone well. I think we are going to see constant cases, but schools are getting the support they need, I think, to manage that. Schools have to make sure their online offer is robust, and they've all been given the deadline of the 30th of September, if they haven't done so already, to make sure that's working. And we do know the children at the moment who are self-isolating from those settings are receiving that online support that they need to help their curriculum. And obviously through the kind of contact tracing, even though you might send a whole bubble home, a year group home, there's support then from Public Health England to work out those closer contacts to start reducing the size of the children who need to self-isolate and bring children back into school as quickly as possible. So kind of overall summary. Happy to open up to questions.
Right. Thank you. Thank you for that, Charlotte. That was very comprehensive and very interesting indeed. I think this is something the committee's been looking for some time, that sort of summary. I have Richard Castle, Colin Hay, Brian Robinson in this order, and Leslie Williams, and I have some Stephen Davis, and I have some questions of my own at the end. So over to you, Richard.
Thank you very much, Charlotte, both for the report itself and for the very good explanation you've just given us. I should declare my standing interest as Chair of Governors at Gastrell's Community Primary School in Stroud. I've got one observation, one plea, and three very straightforward questions, so it shouldn't take too long from me. Firstly, the COVID-19 school cell seems to have done a cracking job, and I would say that from certainly our primary school and the Stroud locality. Very grateful for what you've done. However, that does bring me to the plea, if I may. You mentioned the length and the sheer amount of guidance that received from the central government. And as a case in point, you will be well aware that the latest DfE guidance before reopening in September arrived on the Friday evening before the bank holiday, before the schools were going to open, which did not go down well, I have to say. I'd ask if you would consider making a plea from the council perspective or the county perspective. Two things. One, the obvious one, can we please have this a little earlier from the point of view of ease of implementation? But more importantly, you will be aware, Charlotte, of the volume of paper that arrived on that Friday evening, for instance. It would be, some of the amendments were actually really, really small. And if they could just find a way of putting track changes or put it in red font so we can see what's changed, it saves plodding through 102 pages to try and find out where the comma has moved. So if there could be any representation to central government on that, that would be extremely helpful. Moving on to the 3 points. First, referring to your report, if I may, on page 1 of that, about halfway down, you talk about the request for reimbursement for costs, and you also alluded to that in your oral bit. Can I just ask, the comment, there is an expectation schools should fund this where possible if they have a budget surplus. Can I just ask where that policy direction came from? In other words, was it statutory or was it done at council level? Because there's something about good housekeeping in there and being penalised for it. Secondly, moving on to page 5 of your report, talking about the 107.5k grant from DfE to enable targeting training for schools, which again you alluded to. I just note on that one, it says that at time of writing, the offer is currently under development. What I would say to you, and you acknowledge this yourself, I think, in your preliminaries, the time is now. This is when our children and young people are at most risk. So we don't want to spend too long in policy development. I think what we need to do is very clear, and it just needs the resources in place to do that. So if you had a comment on that, I'd be grateful. And my final one is just, I think you could hopefully clear up very quickly a misunderstanding that may have arrived in the school, in the Stroud school area. This is on page 6 of your report. And you talk about this, all schools receiving £80 per pupil on roll in catch-up funding. That to me is very straightforward, and that is, as I understand it, what the government direction was. There is a rumour, certainly within the Stroud area, that is being not allocated strictly on the basis of £80 per pupil, but there's some degree of overhead or something that's being taken out of that. And my point on that is for schools at the minute, you'll be aware of the funding constraints all of us are under, and Charlotte Blanche, I'm sure, would echo that. We need to be clear now on what funding is going to be available. And it does, I have to say, when you've got a leaking roof in reception classroom and you need to do something about it, not from the capital side, just buckets to hold the water. We need to know exactly what money. £80 is very different from £65. So if you give us some clarity on that, Charlotte, I'd be hugely grateful, and thank you.
Richard.
Yeah, of course, Richard. So firstly, your plea. Yes, it's been something that's been my plea throughout this whole issue with the DfE, and we raise it constantly with them, particularly in terms of the timeliness of the information. They have now given a list of updates, but as you quite rightly say, it still doesn't help you in terms of identifying where it is in the documents and what that is. We will continue to raise that. One of the things that we've been using that COVID heads group for is trying to pick out those key themes to get that information. But again, like schools, we only get the guidance at exactly the same time, and it takes that time for us to kind of go through and work out that for ourselves. In terms of your question around covering costs, that was the direct guidance from the DfE. So all the requests for additional funding went from individual schools straight to the DfE, and we looked at in those three categories to receive money. Schools had to declare what their kind of carry forward surplus was as part of that process. And I know a number of schools in the county didn't submit a claim for additional cost because of their contingency, which schools quite rightly keep for the same reason that you would need to kind of respond to any issue. So I agree that I do think that has had a negative impact on some of our schools in terms of where they might have been planning to spend their money going forward. The grant for the training, so the training has been developed by the Anne Freud Association, so this is a national programme. So the trainer programme is starting now. So next week and the following week, we will have our education psychologists being trained to deliver that training. We can then be in a position then to train schools once that training is in place. I agree with you. I would like to have had that training for staff back in the summer, so we could be hitting the ground running in September. But unfortunately, obviously, we're having to abide by the DfE timescales on that. And just reassurance, in terms of the catch-up funding, it is £80 per pupil that will go to every school. It will come through the usual funding arrangements, so it'll be passported by the local authority to schools, and obviously academies will receive it from the ESFA. But it will come in 3 tranches to schools, but all of that funding will be directed to schools who will need that. There is also the ability for schools to access national catch-up support as well for children where that's needed, and we've highlighted that to schools as well.
Thank you. Richard, does that fully answer your question?
It does. It's very clear, and thank you, Charlotte.
Thank you very much. Thank you very much, Charlotte. Can we come on to Colin now? Just to remind you, I've got Colin, Brian, Leslie, Stephen, and myself. I will check if there's any more, but that's the current order. Over to you, Colin.
Okay. First of all, Charlotte, I want to preface any remarks by saying I think the work that's been done by both the department and individual schools has been really good in some very difficult circumstances. And whilst children haven't been there, I don't think we can underestimate the stress that teachers have been under during that period. So, you know, it's well done to everybody concerned. Though I do have a number of questions, which hopefully don't negate that. You talk about an enhancement for the school psychology service to deal with pupils coming back. But I heard about suicide rates, both for younger people and older people. And it does appear that suicide rates for younger people have gone down. Older people, it's gone up, I mean, probably for different reasons and work-related and so on and so forth. But the inference does seem to be that the school environment, I'm not saying the school environment and that mixing of pupils together is the cause of stress, and in a sense, no surprise there. So, and I recognise the amount of work that's already gone into it, and what the enhancements that are there, and that's really needed because it's very clear that we need to concentrate on that whole school environment and pupils amongst themselves as being a major issue. I'm sorry about that. I should have put it on mute. So that's the first question. There's a tiny thing on school transport which says that anyone entitled to free transport can have disposable masks. And I just think for the cost of it, and the differentiation, if somebody needs a mask, you ought to be able to have one on entering the bus. Because then if someone who pays for the transport doesn't come on with a mask, what happens then? It causes all sorts of issues. And I just think for the cost of it, it would just be simpler just to say, please bring a mask, and if you haven't got one, you can have one. And I was really pleased to see that the number of NEETs that you thought might have increased have stayed pretty stable. And I know a lot of work has been done. And I think it was especially difficult because of the, from my point of view, the farce of the exam results and the amount of stress and anxiety that was caused to people because of that. So in a sense, I am saying well done on that one, but we do need to keep an eye on it. And I just think that, in a sense, Richard has made this clear. The inconsistency, lateness of government advice has been really difficult to deal with. And I do think that, as a committee, we are there to see and, ask why things are going wrong. And that's put a terrible strain on people throughout. And again, you did say that in terms of the remote working, work has been done by OCL, I think it was you said. And again, I think I'm of a certain age. So going back to, times past, we could have done a lot more with all schools in providing some sort of consistency across the board. And I think there's a loss there. And I think when you have a national crisis, we never know when the next one's going to come along. That issue of our relationship with the schools and the way it's changed caused problems. And I know reference has been made before that, Gloucestershire's relationship with its schools has at times been quite difficult. And I hope that this whole COVID experience will give some confidence. And I do think that across the board, we should build on those relationships because they're so important at such a time. I've said a number of bits, and some are questions and some are comments, but I look forward to hearing some of those answers. Thank you.
Colin, yes, Charlotte.
Yeah, of course. Thank you, Chair. I think, Colin, I would agree with a number of points you've raised there. And when we're talking about heads resilience, we're talking about head teachers who heard on the news that schools would be closed, and then read the guidance and found out they wouldn't be closed at all. But actually, perception is they're not actually having to do that work at a time where they were having to deal with quite significant challenges, I think, from their own communities and their staff. Awaiting that timeliness of guidance, having to work through all of the holiday periods to do that. And I mean, our heads in the county work incredibly hard and are incredibly dedicated. but I think this has pushed a lot of those heads to their limit. And I think, you know, whilst it's a huge success story in Gloucestershire, I do think, you know, part of our role going forward, and you mentioned in terms of our relationships with schools, is to maintain the well-being of heads as well, and doing what we can to support them in actually what has been a really challenging job. And they've had to completely understand areas of business that they would never have had to be involved in before, and kind of almost become the experts in terms of reassuring everybody that they're doing what they need to do. So I do feel, as you say, that kind of that relationship with schools is really important. I think the COVID group and our work with the primary partnerships has paid dividends in that respect. We had a couple of secondees from the RSC's office in the council during the pandemic, and one of the pieces of work that we asked them to do was talk to chairs of associations and partnership heads, kind of lessons learned, what's worked really well from your perspective about the local authority, and what do we need to do going forward. And I think, you know, there was some lessons to be learned in terms of our timeliness of drawing together multiple internal systems to try and respond to things. So a kind of a COVID risk assessment template, which had to go through the SHE unit, public health, our property services colleagues, and how quickly we managed to kind of corral everyone to get that when schools have the guidance at the same time that we do to kind of mitigate some of that. But also how we use this opportunity and this renewed relationship to continue in the future and make sure we develop that. There have been some challenges. I'll be honest, you know, we're still in a position of that kind of two-tiered system where we are talking to academies and supporting academies in the same way as any other school, but they are also getting those messages from the Regional Schools Commissioner, which don't always tally, and we have tried really hard to support schools in consistency. But I will say, particularly at secondary level, with the number of academies and multi-academy trusts in that, we've really struggled to get that level of consistency, even when we've been working really closely with the chairs of the clusters and the partnerships to try and facilitate that. But I think that's definitely something that we will continue to do, and it's very much firmly on our radar to have those discussions now with the Regional Schools Commissioner and to raise those and see how we can move forward. And I know, I'll say it for Chris, in terms of his vision for the education strategy in Gloucestershire, is very much about tying up all those partners together to have that sense of county ownership and working together. And I think there's strength in that. And I think we're probably now further on in that journey than we ever have been. I agree with you around the mental health impact. And I think, you know, we're not just talking about mental health impact of children returning to schools. We're talking about the health impact of children who have been at home, separated from friendship groups, all the social activities, kind of their whole normal life. So I'm pleased that we've got that input from the DFE to help with that. We've also assigned £500,000 of the COVID funding that the County Council has received to help us as an education service go in and offer dedicated support to individual schools or individual children where they're struggling with that. And that's where I think this lockdown survey that we've had, where we do know we've seen that increase in mental health issues for children in Key Stage 4, will really help us target that effectively and make sure we're putting the right support in place. There has been a lot of additional mental health support put in place across the county, and with a number of different organisations providing that support up until now. But we know that's COVID related, it's temporary. So this is about like sustainability and how we change our education services to make sure schools are getting the support that they need and taking us on that journey. I think in terms of masks, so we focused on those children where the County Council had responsibility first. We do know a lot of children have their own masks anyway for kind of moving around society, but where the larger providers were providing school transport, so Stagecoach and others, they were providing disposable face masks for those children who needed one. To help them with that, so to make sure that no child was turned away from transport, but also to really support those children who did need that bit of extra support. But obviously that was the kind of provider market rather than the local authority doing that. And you're right, I think the transition panels for the NEETs has worked extremely well. It's a pilot that we started last year. Obviously this year we kind of had a greater focus on a number of children, which I think has helped us refine that, but that's definitely something that we are advocating for going forward, to make sure that we have those right systems in place to help those transition points. And whilst that's been a particular issue this year, we've also got to bear in mind that next year's cohort have also been through this, haven't necessarily had all the time that they might need to readjust the school and get back into that learning environment, alongside the pressure to catch up, that we'll see this for a few years now, and we need to make sure that we continue that support.
Thank you, Charlotte. Yes, there were a lot of interesting points that I thought you brought out there, particularly around the mental health support and the issues about sustainability about post-COVID. That's maybe something we can pick up at another committee meeting. Can I move on to Brian now?
Yes, thank you, Chairman. First of all, I would like to echo the views of others that we should, as a committee, thank all those involved in making sure we've got as many children back in school. And as we've heard, I think this has been a tremendous result for Gloucestershire, and therefore we should make sure that the thanks from the committee goes out to the teachers, the head teachers, the staff in the county council, and the parents and pupils that have engaged, because to get 90% back is a huge achievement, and I think we should recognise that. But nevertheless, you know, and I think we always end up then focusing on the on some of the challenges. If the number not in school was normally about 5%, and it's now sort of 10%, on my rough calculations, that's around about 4,000 extra children who may not be in school. And we know from previous work that when they're in school, they're learning, and when they're not, sometimes we have other things developing. So I think that group, which is now twice as big as it was, is a very important area we need to be focused on. And I wondered if we knew which sort of, is this spread across all of the year groups, or are certain year groups more likely to be affected in this way? So that's one of my questions. I'm avoiding things that have already been covered, so I'm just picking on a couple of points here. We don't know, you talked about the budget issues still being done, but I would like the committee to see in future the costs of the additional transport in particular fed through, so that we can understand those at a future meeting. I'm interested, because the school results this year were done differently, as we know, because it was well publicised. Some of the students at GCSE level were getting higher than maybe anticipated results, and I wondered whether that had any impact on their decisions then as to what they did at sixth form and college, and whether that's had any consequential impact on some of the schools and colleges in particular, because it just seems to me that there may be feeding different choices there, which may have some repercussions. So is there any evidence of that? And my final point, which I think you did pick up on a bit with the talk of the Regional Schools Commissioner, there were quite a lot of challenges in the educational system in Gloucestershire, with some schools and special measures and that. Are these things still being progressed, or are they effectively on the back burner because we're just trying to cope in the time being? So that's my question. Thank you.
Thank you, Brian. Just before Charlotte answers, just on that last point, I'm aware of one school in special measures, Tuffley Primary, and the takeover by the Sands Academy is going ahead despite through the lockdown. I'm actually meeting with the Sands Academy at Tuffley Primary tomorrow. Obviously, that's one in my patch, but I'm aware that is going on, Brian. But over to Charlotte to answer your questions.
Yeah, thank you, Chair. Thank you, Brian. I'll start with attendance reporting, because I think that's interesting. Now, as a local authority, because we have such a mixed economy of schools, we usually look at our attendance data a term behind, so we know we've got all the data in from all of our schools and can start to pick up patterns. Because now obviously we're focusing on that daily attendance to see what's emerging. One of the issues that we've got is obviously the 90.5% attendance rate was actually missing the data of 46 schools. So for me, The first issue that we have to tackle is getting all schools to provide their data, because actually then that provides an understated picture if you can't see all of that. So I think part of that issue is our attendance is going to be higher in the county than we're stating it is. But for me, it's about understanding what that looks like and making sure we get that data source right. So I think that's our first challenge in the county. We are chasing a lot of schools. We are in daily, communication with the RSC, where we have academies who don't really want to share that level of data with the local authority, but also for some of our schools who are really trying their best to provide the quality of provision to children and record attendance through their usual attendance mechanisms, see the DFE daily return now as kind of too overburdensome, if you like. So I think there's some challenges there in kind of schools' desire to feed the system, if you like, rather than just kind of focusing on their own children. So there's some work there for us to do. In terms of non-attendance, it is predominantly across all year groups. And we've seen, probably as you would expect, lower return rate to some of our alternative provision schools, some of our vulnerable children. So one of the pieces of work that we are taking on that data analysis is picking up those schools who have less than 80% return rate and targeting our attendance efforts in conversations with those schools to understand what's happening for them, but also comparing this year's attendance to last year's, which will look very different school to school. Again, I think one of the other issues with the DFE reporting system is at the moment where some of our primary schools and infant schools haven't got all reception children on roll full time. When they're not attending, it looks like an attendance issue when actually it's a planned phased transition for schools, which I think get through the next few weeks when most children will be in school. And I think, again, we'll be able to kind of leave that issue to one side and have a better picture of that. So I think it goes back to having that school overview, and then particularly working with social care colleagues and education colleagues to make sure that we're targeting those most vulnerable children and having those conversations to understand those barriers to attendance. In terms of transport costs, that piece of work is currently being undertaken. So we know we had £500,000 for our first tranche of funding to support this. So we have to report by tomorrow what we believe our current spend has been and our projected spend in terms of helping the DFE understand which local authorities may need more funding going forward. And as one of the county councils, and we always are under much more pressure than our kind of urban counterparts in terms of homeschool transport. So we would be expecting to receive more money through that system. Picking up your point about GCSE gradings, I don't think we've seen any real evidence of that yet. But we are in the middle of setting up a meeting between Gloucestershire College, some of our secondary schools, and our own internal services, because I think the college are particularly concerned about their kind of level 1, level 2 courses that would start September, October time. If actually a child starts to struggle on a more academic course, they've missed the boat in terms of registration. So the college are seeking to offer a later course, perhaps kind of November, December time, in terms of entrance onto that. So children who are finding they're struggling have another route to keep them in education on a more appropriate course. So we're trying to explore and see what that looks like if we are in a position where some children are struggling and would normally then become NEET as a result of that. And in terms of kind of Ofsted, so Ofsted have said that they will not be carrying out full inspections until January. Although we do know they are undertaking focused visits, so it won't end up in a school rating, but very much having that conversation with schools about their response to COVID, what they've been doing. Yes, it's virtual, it's a focused visit, but this is still Ofsted inspectors scrutinising the work of schools, so heads still feel that same level of pressure that comes with that. And whilst it won't give a judgment, it will inform the ongoing inspection programme and how quickly some of those schools might be inspected when we get back into next year. Alongside that, the Regional Schools Commissioner are continuing to offer school-to-school support where that's needed for schools that are struggling. And throughout the whole pandemic, where we've had schools of concern as a local authority, we've continued holding our project groups with those schools virtually throughout this whole arena, on the basis that actually, whilst it has been a really tough time for heads, in some ways it's given them a chance to kind of collect their thoughts and refocus. So we have made sure the support has continued to go into schools, and we've continued to help schools on their improvement journey ahead of the upcoming inspection regime when it starts again.
Thanks, Charlotte. So,
Andrew, could I just come in on the back of Charlotte there about the results issue? Because that was a debacle this summer, and we reverted to teacher assessments following hullabaloo, didn't we, expressed by the teacher unions, head teacher unions and local authorities. But what that's led to is a what I call a positive problem, in that teacher assessments were by and large higher than what grades were allocated by the qualifications authorities. So the problem it created is that when children got their grades, they took choices for places at university based upon their grades from the examinations. When it was reverted to teacher assessment, the vast majority of children had an uplift in their qualification outputs. So it gave them scope to apply to one of the so-called better universities. So it was a good thing that teachers' assessments were considered to be the more accurate assessment, because it was done on analytics. And, you know, for example, if you were an improving school, improving results by 10%, you were just allocated the same number of grades that you got the previous year. So that's how analytics work. So children did get a better deal by the teacher assessments, but their choices were affected by the initial notification of grades that they got. So they may not be going to the university of their choice, although universities are being quite flexible on looking again at applications to university and colleges. So it's a kind of positive problem, but it's still a problem.
Chris, so Brian, did you want to come back on something?
No, I'm happy with that. Thank you very much.
Okay, thanks. In which case, can we move on to Leslie, please?
Thank you very much indeed. Thank you, Charlotte, and thank you everybody who, as far as I can gather, have been looking after the young people of Gloucestershire really well, and it's really appreciated. And I think it's important that that's recognised, and that the schools know we appreciate them. And I know how difficult it's been to them, because I'm sort of have quite a lot of contact with the head teacher at Park Infant, and she said she was preparing. She lives away at the weekend, preparing to come back on a Monday to school, and suddenly heard on the radio first thing in the morning, another early riser, that things had changed. And so yes, it's been touched on already, but the level of communication from government has been dire. And I just don't think we should underestimate the impact that would have on people who had been working to put in measures to do certain things, and then suddenly discover everything's changed. I mean, it really is treating people with derision, and I absolutely abhor it. And so I think that we must give them all credit for perpetually having to manage a very, very difficult situation. And I think it is so important that that's recognised. So I've got some scribbled thoughts in no particular order. You mentioned laptops for particular young people. Did every eligible student get a laptop? So that's the first question. Thank you for mentioning transport. I was wondering how that was working. And I don't agree with Colin about the masks. Masks might seem inexpensive to somebody who can afford them, but if you're on a limited income and you're budgeting and you're busy and you've got all the other effects of what it's like to struggle on a low income and managing families, etc. It's just not something else to think about. And I think if we can relieve that pressure, even if it's not a particularly hefty financial one, it might be to some. I just think it's a way of making sure that it's something they don't have to think about. I am kind of concerned about sort of general capacity to do all the supporting that's required. I mean, I thought ed sites were like hen's teeth, old cattle, rare breed and all that. So can I have some reassurance that that capacity is there, because it is needed, it's going to be more needed, and so yeah, and in other areas you're talking about doing things. So it does sound to me as if people who've been putting in the hours and working under very difficult conditions are being required to do more. And that applies to teachers too, who've been having to do everything else and plan lessons for people who are learning at home. So it's, you know, it's the capacity issue, I think, is there. You might have said this, and I apologise if I've missed it. Are there any schools actually closed at the moment? You mentioned some being on amber, but are there any actually closed? Providing protection for schools. Now, I know that they got a sort of a kit, a basic kit, and anything else they needed, they had to get hold of themselves. And I understand that the county did offer to supply them at a sort of a knockdown price. But have they all got? Are they all well equipped? And as things might, you know, I think we're going to see things changing again. Are they all sufficiently well equipped with all the stuff they need to ensure that they can carry on if the school is going to be open? Do we know the percentage increase in people who are now opting for home education? That would be worse. And it's an area that's always worried me, because I don't know how it can be overseen, because if a family doesn't wish to let somebody from the county council come in to make sure everything's all right, they don't have to let them come in. You know, and that's not good news. I can't think of anything else, but if I do, I will put it on the chat line. Thank you very much.
Thank you, Leslie. Charlotte, do you want to come back on any? I think you mentioned the number in Gloucestershire who were going up, the increase in elective homeschooling. I don't know if you mentioned the percentage.
No, so I'll start with that one then, Andrew. Thank you, Leslie. So the number is 110 for the last 2 weeks. For the whole month of September last year was 56. So I would say probably a fourfold increase in terms of numbers of home educated pupils. And again, it's something that we're concerned about. We are reflecting the national trends, but it's something that we need to watch very closely. And also, from my perspective, we have a lot of parents who are telling us this is temporary, because once we feel better about COVID, we want to go back into schools. So there's something there also about how we help schools and transition those children back in. At what point that might look like, given that they won't have had that same support that children returning right now will have had. So it kind of probably moves me into the EPS capacity, and you're right. The DFE have made it possible for retired EPs to come back, or no longer practicing EPs to come back into practice and be re-registered. So to try and help that kind of national issue, it was one of the decisions that we made when we were deciding how to roll out the training, and actually the benefit of having our own EPS service deliver the training is about having that connectivity to other parts of the system, and making sure that we can continue to support schools on that journey. So the grant funding that we've got, rather than using that to fund our own EPs, and we are anticipating obviously the statutory work in terms of assessing children for an EHCP is a very finite and time limited piece of work. So that is where we will be using private EP capacity, and we know we've got a strong private sector in the county to backfill some of that statutory work. So actually using our EP service where we feel it has best value, but making sure then we can continue to offer all the other support that we need to. Laptops, the DFE put a cap on the number of laptops that could be ordered by schools and by local authorities. So for our vulnerable children with a social worker, we were given about 1,500 laptops there, against our much larger cohort. So it was very much working with individual social workers and families to work out those children who were struggling, either because they didn't have any access to technology or kind of the 3G, 4G routers, or were using their phones or were sharing resources, and prioritising those children, care leavers, more than children that had their own devices. So not every eligible student, which was any child with a social worker, had a laptop, but every child who's needed a laptop to enable them to work remotely from home has been given one. We do have some surplus still left in our offer. So we are now working with those individual schools where they are also picking up other issues to make sure those children get laptops. Most of our year 10 children who needed it had a laptop as well in that same reason. And I know that where schools identified children who weren't eligible, who were struggling, schools were loaning their own laptops out. And part of our children's fund, we had referrals from families for funds to purchase laptops. So we made sure that other vulnerable children got laptops that way. And we're currently working with the DfE to make sure that if we end up in kind of a bit more of a lockdown situation, that again we have a pile of laptops to make sure different children can access them at different times if that's needed, so to kind of make sure that's happening. And one of the things that schools will be doing as part of their remote learning offer now is having those conversations with children and parents about what the experience was like with them, what the struggles were, and that kind of softer intelligence again I think will help us plan if we end up in this situation in the future and where we have got some of that spare capacity. No school is closed. Every single school in the county is open. We have confirmed cases in 3 of our settings, which have led to numbers of children self-isolating. You've probably picked this up in the media already because sometimes the social media chain is far quicker than the formal chains. So we have Pates High School in Cheltenham that have sent home their year 10 children due to a confirmed case. Warden Hill have sent a class of children home because of a confirmed case. And Cirencester College have 62 children self-isolating, and there were 3 confirmed pupil cases there. They all offered remote learning, but no school has had to close. And in terms of our escalation process in response to COVID and the safe systems of control, the whole principle behind that was if we were in a situation with a confirmed case, schools could lock down individual groups of children and not get to a position where we were having to lock down a whole school. And in terms of kind of the county-wide perspective, closing any school, even in a kind of a whole county lockdown situation, would be an absolutely last resort, and there are a number of different phases to that to make sure that schools can stay open regardless of what else might be happening. And then just kind of picking up your point, Leslie, around PPE, we did issue all schools with the emergency pack. Really in schools, it's about what we're seeing more than PPE was hand sanitizer, and kind of the normal kind of cleaning products that they would need. Back at the start of the pandemic, I think PPE was rarer than EPs at some point to try and get hold of, but we've kind of come through that supply chain now. We still have the ability for schools to order PPE through us if they need to, but the DfE now have got a portal as well. So there's plenty of avenues for schools to get that, but it's been more around gloves and hand sanitizer than anything else, where schools have needed special requests. So some of our special schools where teachers have needed kind of more medical visors when they're working with those children, they've been coming to the local authority and we've been providing that kind of more specialist PPE for children and for those staff working with them as well.
Thank you very much, Andrew. A couple of things I missed, and one of them was it was covered on the radio earlier today about increasing numbers for young people who would have had awkward lives at home, safeguarding issues. What sort of an increase have we seen so far?
So in terms of MASH referrals, we know they were low, the lowest when schools were closed. We are now starting to see that increase more as schools open, as we'd expected. I mean, Chris will probably want to add more to this, but I think it's one of the things that we're very focused on as Children's Services is that latent demand in the system and how we make sure that we are ready to respond to that. So I know there's been conversations, particularly around the MASH, around making sure we've got the right level of support at the front door to deal with that increase in referrals, and then making sure how we triage that and go through the system. So it's very much on our radar. Again, it's based on a lot of assumptions, but very much about making sure that we have as much capacity and we have as much awareness of what's coming as possible.
So, Chair, it's 15% down week for week, 12 months on. But schools have only been open 2 weeks. The first week, many schools were only open for a day or two. They had inset days, so children weren't present. Then we've had a full week and this week. So given the logistics of managing COVID-19 on a school premises, a lot of focus has been on that. And I don't think children have been back in school long enough for teachers yet to kind of hear the worries that children have expressed about their period at home or what's been happening at home. So that's why we think this latent demand in the system is a real threat. And we've made provision within the budget and within staffing to deal with a spike in activity around about October, November. So we don't expect that 15% suppression of workflows to continue for much longer. In fact, we'll see a bounce back effect to a point where workflows will be much higher week for week, 12 months on.
Thank you, Chris.
And I put a question up about when will we see the transition survey?
So there's two surveys, Leslie. One is that Year 6 transition, which we've got that, happy to share, but I don't think it really raised anything different to what we would normally see in terms of excited about going to a new school, excited about a new school uniform, excited about making new friends, but worried they might get lost. The lessons will be different. They aren't going with their friends. So from my perspective, there wasn't anything specifically COVID related that stood out in that, which is why I'm waiting for the lockdown survey, which we'll get in a fortnight. Because I think comparing the Year 6 data from the lockdown survey with the transition survey will give us far more meaningful information there. And again, that broader perspective on how it's affected all children from Year 3 to Year 13.
Thank you, Charlotte. I've now got Stephen Davis, I've got Tamara and Charlotte Blanche, after which I'll speak. So over to you, Stephen.
Thank you for that, Chairman. And I think we all want to say thanks to everybody involved in this. Clearly a huge amount of work has gone on in incredibly difficult and unpredictable times. One question I did have is not in the Gloucestershire area, but I have picked up that there's been a variation in the quality of online education that went on in full lockdown, even within a school where, one subject does really well and sends out work and another one doesn't, and they've had absolutely no continual education. I wonder if we'd measured that at all about how good schools had been in providing continued education remotely. My second question is, and I think partly answered, but it's how prepared are we should there be a second spike? And particularly related to that, are we better prepared for continuing education remotely if we need to, if we did have to close schools? And then my third question is Charlotte, you used the word trauma at one point, and there's clearly a lot of concern about the stress that pupils have been under during this time. But I wondered if there's a definition, because I'm always concerned that if you tell people that they might be stressed, and they probably will be, but then there are clearly people who are truly stressed and we need to focus help on. So I'm always interested in that, the people being concerned and worried, of which many of us are, and some sort of measure and definition so we can focus on any help. Thank you.
Stephen. Actually, a couple of those were similar to the questions that I was going to ask, particularly about comparisons. I was just going to ask about secondary, primary, whether there's grammar, non-grammar, private, state sector comparisons as well. I thought that was really good. And also on the continued second lockdown as well, I was going to ask, could we manage like this for 3 years if COVID is around for 3 years and we have restrictions? But great. Charlotte?
Mm-hmm. Yeah, thank you, Andrew. So I think in terms of quality of online provision, yes, absolute variation, as you say, between schools, but also between different year groups. I think some of that comes down to schools' preparedness for dealing with that. And we saw secondary schools, I think, respond far more quickly because they had the infrastructure behind them to do that, and kind of have that very good backwards and forwards communication. So as well as kind of putting the information online, getting that feedback and kind of having that movement, I think a lot of our primary schools did an amazing job with that as well, but obviously had a more limited resources to do that. And I think for some schools it very much then depended on how many children that you had in your school that you were also trying to educate during lockdown, as well as that kind of online facility. So I think there has been a variation in that. And I think also over time, I would say the online offer by July was vastly improved on the online offer that happened in March, as you would expect, as head teachers hadn't anticipated having to kind of provide that level of remote learning for such a long period of time. So kind of initially those schools that were sending home paper-based work very quickly then had to realise this was a longer term effort. And I think also some of our multi-academy trusts benefited again from that infrastructure and having people to develop things for them. And it was something as a local authority we were trying to help schools with, and obviously use those kind of DFE resources as well. I think we're in a much better place going forward. All schools have to revise their offer in terms of sustainability and effectiveness by the end of this month, in terms of being able to look at that. And I know schools are having to look at different levels of remote learning. So there will be the instance where a few children are at home. And what does their online learning offer look like to potentially a year group, and how might you respond to that? Obviously, it's easier for teachers of particular year groups to focus on remote learning if all of their children are learning at home than it is having to do that blend of trying to teach some children in the classroom and some at school and keeping that up to date. So I think we'll see different experiences there, and there's lots of resources out there to help schools do that, and we're providing specific webinars on that subject for schools. I think in terms of measuring the effectiveness, that's quite a challenging thing to do. And I think from my perspective, that's where schools at the moment are playing their part with children and families as part of adapting their online offer going forward, to actually see how families and children felt about the online offer. As a school, you can think you've got a really good offer, but actually how accessible has it been to everybody and learning from that? So I think very much we're still in that early phase of measuring that, one, in terms of getting that immediate feedback from children, young people and their families, but also then for schools to be able to assess the progress made by those children at home and see if that collaborates what people are saying about their online learning experience as well. So I think we'll take a bit longer to really tease that out. In terms of the second spike preparation, I would say we're as ready as we can be, not really knowing what's going to happen. We're working with schools to map out the different scenarios. So schools have been asked to look at a plan where a secondary school might have to take children in rotation and what that might look like. And schools are starting to do that now, and that will obviously inform their remote learning offer and how they manage that on-site work. The DFE guidance in collaboration with the PHE has been very much that we should keep schools open as far as possible. So actually it will be a last resort that they would be closing primary schools. So primary schools would, on the whole, try and remain open for all of their children. At the very kind of worst case scenario, we would be back in the same position that we were in March, with all schools closing in a particular area or part of the county, which is probably more likely to be on that kind of district level, for only key worker children and vulnerable children, which again, we know we had good success with that back at the start, and we know we've learnt from that. So I would say schools are in a really good position to respond. The challenge for schools is having to keep that live, how much notice they'll be given to implement any of that, and whether then that comes with any additional guidance from the DfE. What we are doing as part of the local authority role in that is liaising with our regional colleagues, our national colleagues, to understand the experiences that they're going through, knowing that some areas are in that situation already now, to gauge that learning so we can help feed that into the system so we can be more prepared for what might happen and what that looks like. You raise a really interesting point, Stephen, around definitions, and I think it's probably needs a health response there, but I think there's a number of different definitions out there, and I guess for me, you know, regardless of the label that you put on this, every one of us, whether you're a child or an adult, however old you are, we've all been impacted by this in different ways. And it's about having that kind of graduated approach to respond to anything that any child going back into school has had to deal with during this time, and having that flexible response. So as for a definitive definition, I'd have to take that away to health colleagues, but I think there's a number of definitions, and probably everyone would say not one of them is right.
Yeah, Charlotte, my point on that is slightly different. It's you're right, everybody's going to need something, but it's identifying, and that's why I was interested in the trauma word, because that sounds quite serious. It's identifying those who have been very seriously impacted, quite a lot of help, because then, you know, if you don't identify them, you can't target that help. So it's very, I just get nervous when people throw different words around: stress, trauma, anxiety. We all suffer that, and there's been a lot of it around, but I do worry there are individuals out there who are more affected than others, and we need to target our help tonight. That's why I was interested in whether any work can be done on targeting.
Yeah, absolutely, Stephen. So just to reassure you on that, that's part of the reason for the mental health and wellbeing training that's going out to schools, just to again, more kind of reconfirming those principles and helping schools take a different approach to that. And that's also part of our team around the locality cluster approach, where we are asking schools to work with us to identify those children who might be particularly struggling. And that is then where we can then target kind of our more specialist and more professional support to those children who need it the most.
Thank you.
Thank you very much, Charlotte, and thank you, Stephen, for those questions. I'm aware that time is moving on rather rapidly. I've got Tamara, who is one of our ambassadors, and Charlotte. Now, for those that can't see Tamara in the participant list, Tamara is logged on as Lynn Green. Tamara, would you like to unmute yourself and perhaps introduce yourself before you ask your question? Perhaps we've lost Tamara. Can we go into Charlotte, and we'll come back to Tamara if she comes back. Charlotte.
Yeah, hi. Thanks, Charlotte. I've got lots of little bits here, and some of them won't need responding to. It's just so basically, well-being of staff. I'm really concerned as a head teacher at the moment at the well-being of all of my staff. I'm trying to do whatever I can to look after them, as are all of the rest of the Cheltenham head teachers and the hub that I'm part of. But they are tired. They're very down already, and we've been really careful about protecting holidays for as many staff as we can. Anything at all, locally and nationally, that we can really push as a whole group about the media surrounding people that work in schools, and the fact that everybody's not lazy, would be really, really helpful, because actually there's certain things that we really can't, there's so many external factors linked to media that we just can't do anything about ourselves in schools. So we can try as hard as we might within the local authority, but actually any positive media about what's going on would be really, really useful, because there's actually nothing else that we as heads can think of. So that's the first thing. In terms of well-being of staff, I have had lots of different conversations with both governors across many different schools, and head teachers, of course, that I'm working with on a daily basis, and I think governor services could perhaps help in some way. There have been reminders coming through governor services for chairs of governors to check in on well-being of head teachers. But if I'm honest with you, Charlotte, I don't think that they have any idea what to do other than to phone them or to ask for a meeting, and that's not necessarily what heads need. So what's coming through is actually perhaps my chair of governors has been trying to give other chairs of governors ideas, but even just to send them some flowers and say we appreciate what you're doing. I know that sounds really ridiculous, but actually I think it's just an acknowledgement that we can't do anything about this. We can't take it away from you, but thank you, because we're kind of getting it from all directions. Please don't let them all arrive on the same day though, because they'll have known somebody said something. But I think that some ideas from governor services to the governors as to what they could do would be really helpful, because they just don't know, and they want to help but don't know how to, especially as they've been told not to kind of physically go in, which is absolutely right. There is a feeling, I think, and Charlotte would, I'm sure, back this one up. So I'm not asking you to come back to it, but I wonder if there's some cross scrutiny work that we can do with other panels here about external agencies from schools. So health, for example, NHS, PHE, the way that everybody else is working, just not backing up what we're trying to do in school. So the different messages that are coming out about testing kits, for example, nothing is coherent. PHE worked on some cards, and then 111 have released other cards, and we're having people sent to us to collect test kits. Well, we've only got 10 of them, and we can only order them every 2 weeks. There's just not a joined up approach, and I wonder if the health scrutiny needs to know this and needs to actually be scrutinised about it. And I suppose that there's people that sit on both boards, so I'm looking for that there. Laptops. Any conversation, Charlotte, that you have with DfE? I know I was part of a pilot last week where they were looking at some prototypes of the forms that they're going to be using on site, online, for people to order laptops that we've been allocated to schools. There's no point in having them when we have a local lockdown. We need them right now, because we're going to be expected to set these laptops up. I have 1 day a week of IT support. That's not unusual in schools, particularly primary schools, and my allocation, I've been told, is going to be something like 30 laptops. Well, wonderful, but I need them now, not within 24 hours of a lockdown. And the online offer, I was wondering if there's going to be any monitoring of what people are putting in place, so that there is some kind of consistency. I know as Cheltenham heads we've been working together on an offer, but actually is that happening across the county? Because it's really important that children know what Gloucestershire offers, not what Cheltenham or St Paul's offers. It's got to be consistent. And then the last thing really is just a flag up to everybody that we are, as primary schools, we are finding our secondary colleagues incredibly difficult to work with. I think that is, but you alluded to it, Charlotte, perhaps because of the number of academies we've got. I'm really sorry, but that shouldn't be making any difference, and we've got to escalate this to the RSC as a board, as a committee, because, for example, something came out on Monday on the COVID call from yourself, Charlotte, on Monday or Tuesday, that secondary schools should not be holding open days. I've had an invitation through yesterday from a secondary school telling me to advertise it in my newsletter. They're going to be having open mornings for a whole week. Now, I'm at the point now where I now have to make a decision about whether those children, having gone around a secondary school, can come into my school with the same clothes on, and we're being careful. What's the point in us bubbling up and putting all of this effort in if other counterparts, it goes back to these external factors, are not helping us to do what we've been asked to do by the DfE? So I think that some of those things, Charlotte, you can do nothing about. I understand that, but I think that we need to be aware of that as a committee, and we need to do more about it, because it's really not acceptable from schools. It's not just my experience, it's general experience.
Thank you very much for that, Charlotte Blanche. Charlotte Jones, can you respond to that?
Of course, thank you, Chair. Thank you, Charlotte. And I would agree with a lot of what you've said. I'll kind of go back to your staff wellbeing point. Absolutely, and I think it's all staff and heads I would include in that as well, and doing that. So, we have tried to get things out in the media, and we'll continue to do so. I think it's not just for staff health and well-being. I think actually it's just really important recognition of how hard everyone is having to work with this and deal with this. And I know from speaking to a number of your colleagues, actually just managing the expectations of parents on a daily basis. So again, as well as kind of that kind of media presence, also about trying to give something for parents about what they should be expecting from schools and actually what might be a bit over and above what schools should be offering. And we'll certainly pick up the practical support tips with governor services and kind of help chairs do that in a virtual world and what that looks like. The issue that you raise around inconsistent messaging, I think has been escalated. I would agree it's worth an area of closer scrutiny. And I think that has given us particular challenges, particularly for schools on the ground in terms of understanding those messages that are going out. We are currently devising a letter today to go out to schools just to reiterate a few points around testing and what that looks like and who to contact. And in that, we'll be saying, we are that kind of trusted source of support. If you are getting any kind of inconsistency that we can help with, raise it through partnership chairs. We will then be able to escalate individual issues nationally. But we are very much aware of people phoning 111, getting a slightly different nuanced approach. So I think from a county council perspective and with our public health colleagues locally, it's really important that we have the Gloucestershire truth on what schools are expected to do and how parents should respond to that as well. So that's definitely something that we're trying to resolve at the moment, about a kind of quite a live issue. I agree with you on the laptops. I will continue to raise it with the DfE. I think part of the challenge with this is because of the number of laptops that might be needed nationwide, there's an expectation that once the schools kind of come out of lockdown, the laptops go back in the pool for the next school. So it's very much about that recycling and then making sure that they aren't touched for 72 hours and all those kind of other things that come with it. But I agree the logistics of that need to be looked at. And I would agree around the secondary issues. I know we had concerns raised around the transition planning and what that looked like for schools and trying to get an element of consistency. We did expect that not all schools would follow the advice of not to hold open days and evenings, and it's within their right to be able to do that in a safe and secure way should they wish. But I think there's very much some work for us to do in terms of that cross-sector working, bringing the key players together. The RSC are very aware of the challenges that we're having as part of the work that the RSC secondees did in terms of talking to primary partnership chairs. They also spoke to special schools and some secondary heads and had difficulty getting hold of secondary heads and participating. So it was very much an exercise for me for them to see some of the day-to-day challenges that we're facing. It is part of our discussions that we're having with the heads group and with the chair of the secondary association, who's very keen to see what she can do to help support that. But again, you're dealing with a number of different personalities across all the schools there, but we'll continue to push that as much as we can.
Thank you, Charlotte and Charlotte. I think it's good to have a perspective from a head teacher. So it's a different perspective, I think, from perhaps some of the rest of us. But now I'd like to invite Tamara. So for those of you on the call, she's in Lynn Green. She's using Lynn's laptop. Tamara is one of our ambassadors, so she should be able to provide an ambassador's perspective on this. So Tamara, can you unmute and introduce yourself to the committee, because we've not met you before, and then ask your question. Thank you. mute. I think issues.
I've unmuted you, Tamara, so you should be able to just speak.
Got a circle going around over Tamara's video. I don't know if we've lost connection there. Tamara, if there's no way to switch off the video link, it might help. No. Yes, it's not coming across. I'm not hearing you. I think it's probably best if you go back on mute. We'll look at the technical issues, because I'm hoping that later on in the programme, you'll be able to contribute towards our work programme. I'm sorry about that. So I'm sorry to the rest of the committee members. It looks like there's some connection issues to Tamara at the moment. I'm assuming she's in the council offices for this. Is that right, Andrea? It is, and Andrea's nodding. Andrea's nodding. Okay. I'd just like to wrap up. I don't really want to ask many more questions because I think we've had a really good session on this, but we have taken nearly 2 hours. First of all, we've got belated apologies from Bernie Fisher, which were conveyed from Colin. Andrea, could you add that to the list of apologies, please? The second is a technical note. There's included in the agenda papers is inadvertently is a care leavers services plan for 2019-20. I think it was included in error, and I'd like the committee's permission or agreement to take that off the public agenda, off the website for the public agenda, if that's all right with everybody. If anyone desperately disagrees, can you let me know? Okay, I'll take that as agreed. I think as far as my own questions goes, I think Stephen asked really some of the questions, I was getting close to some of the questions that I was coming from. But one question I do have in particular for Charlotte is around the flexi learning that we're starting to see. Are we going to do any monitoring or research or evaluation to see how that's going, see what pitfalls there might be, and in particular to see if there's any child protection issues that might arise if flexi learning becomes much more common in future, either because parents want it or because schools feel obliged to go down that route. I'd like to understand at some point in the future what the impacts of that are, and understand if there's any intention to monitor, evaluate, do some research, and come up with some conclusions. Charlotte?
Yeah, thank you, Chair. I think particularly into flexi school, when I say we've had an increase, we've had 3 in the last couple of weeks, but it's quite an unusual request. And I think probably we're in a position now where schools are probably more inclined to agree it initially to keep children as part of their school community with a view to encourage their attendance than maybe would have been in the past. I think kind of schools are probably more inclined to support families with that. In terms of flexi schooling, schools still retain responsibility for the progress of that child. So it's very much that kind of school responsibility to ensure that it's working for the child, that they're still making that same level of progress, and it's well within a school's gift to withdraw their offer of the flexi schooling approach if they feel that's not working for the child. As part of our kind of blanket home education processes, we track those children for any social care involvement coming up and down the system. So we would do exactly the same for any child who's flexi schooling, to again judge the impact of that, but also make sure that social care colleagues are aware that those families might be considering that, to again have that conversation around whether that is in the best interest of the child to do that. So to kind of have that whole joined up approach, really. And I think the cases that we've heard about are probably a kind of a more as a phased transition maybe back into school than a longer term agreement, but time will tell. And I guess some of that's around public confidence around education and COVID too.
So I guess it was born from my concern that just as a number of people work from home, and that's becoming more popular, perhaps the same will start in education, and flexi learning will become more popular as a trend. And if so, I want to make sure that we're in a position to analyse that. So that's, I guess, really where the concern is coming from. Now, I need to consult the committee. We are nearly at 12 o'clock and we've really only just gone through the first agenda item. Would people like to break for coffee now?
Sorry, Chair, can I interrupt briefly? Can we have another try with Tamara, because her question is very important?
Okay, let's try and go back to Tamara. Tamara, can you unmute again? And I think the connection's come back, has it? Yes.
So Tamara, I've unmuted you, so you should be able to just speak.
But I've still got circles going around on her video link, Andrea. It looks like the connection is poor to her. Have we got one technical on the line?
Chair, it's Rob.
Is there any way if we can tell if she can actually hear us?
Chair, it's Rob England here. I'm hoping you can hear me.
Yes.
Yeah, I've just spoken with Lynn Green and they can hear us absolutely fine. They can see the meeting. It would just appear that there is a problem with their audio feed into the meeting.
Right.
So, yeah, unfortunately, I don't know that we can hear directly from Tamara, but if I can just relay her question, and I hope I do it justice, I'm more than happy to hear from Tamara and Lynn directly if not. So as I understand it, Tamara's question is what the arrangements might be for children and young people in terms of laptop availability, should there be a second lockdown? Because I think she's relating that to her family situation where she is one of 3 children and they have 1 laptop between them. And so in the lockdown, it was particularly difficult for them. So I think that was the nature of the question, Chair.
Very important question, Rob. Can I say thank you to relaying through that that question to me. I'm sorry about the audio feed. Is there anyone who's able to address that audio feed for later on in the meeting?
Chair, I will ring one of my colleagues and ask them to contact Lynn and see what they can do.
Thank you very much, Andrea. Charlotte, about laptops. Are you able to say anything further about laptops? I know Charlotte Blanche raised that idea, but in response to Tamara's question.
Of course, Chair. Thank you. And thank you, Tamara. I am sure having to learn at home throughout lockdown was really, really tricky. And sharing amongst your siblings would have been really hard. We do have laptops available to help young people like yourself in the circumstance if we end up in a second wave. We are asking schools to identify how many laptops they might need for their pupils who they know will struggle, to make sure that we can give them as many as we need when they need it. So I would just say that if your school aren't aware how much you've struggled and how much you would need a laptop, please just let them know, and that will then come through to the local authority and we'll make sure that you get a laptop if you end up in that situation.
Thank you.
Andrew, could I say a little more about that?
Yeah.
Just to give you a few more details, Charlotte referred earlier to the first tranche of laptops, which we got during the summer period. We got 1,558 laptops for vulnerable children. Those came into GCC, and we used intelligence from social workers, applying knowledge of the families that they work with, to identify the 1,558 most needy children and families, and that included laptops and 4G access. So if you think that together we've got 4,000 children in care, children on a CP plan and children with a child in need plan, that's, you know, we've got over 4,000 what you would term or define vulnerable children. So there isn't enough to go round, clearly, and there never has been enough to go round. And the DFE said very clearly at the outset that these were for the most vulnerable children who do not have access to the internet. And by that, they meant those children known to children's social care in those three categories. So what social workers did is identify the most needy children. And it would certainly include care leavers as well. So I don't think Tamara's a care leaver. I think she's not old enough yet, but if she is, then apologies, Tamara. But you would be entitled to one automatically. So that happened, but we still have a small number of laptops available from that tranche. The other sort of raft of IT support that the DFE put out was put out to schools directly at secondary level for year 10 pupils undertaking GCSEs. Those went directly to academies or to us if we had a number of maintained secondary schools, which we did. And by and large, those were nowhere near enough to cover the whole of year 10. You would probably, an average secondary school, get about 20 machines for the neediest 20 year 10 children. So again, nowhere near the coverage that you require. So it was a very good thing to do, but we mustn't kid ourselves that there were sufficient machines in the system to provide for every child that needed one. So we had to have criteria which were prescribed for us by the DFE to allocate those, and it was done on the knowledge and basis of the children known to us in children's social care for that tranche, but for the year 10s it was done by schools themselves in relation to that group. There has been a second wave indicated of machines that are available. We don't have them, they're not here stockpiled. And as Charlotte said, they are only available to areas in lockdown. I don't think, Charlotte, you might be able to correct me, but I don't think they're just for individual schools who have one or two cases or have to isolate and send home a year group. This is for areas, whole areas like Bolton, Blackburn and so forth, who have had to lock down as an area. Those machines will then be released to those areas during lockdown and distributed. So, you know, Charlotte B's plea of can we have them now? Just no, you can't. I'd love to be able to give them to you, but we don't have them to give to you. They're only allocated if an area goes into lockdown. So it's a nice gesture to have on the horizon, but it's not up front. It's only if we go into lockdown, that second phase.
Thanks, Chris. Yeah, I think that's an important thing to go into. Clearly, we haven't got an infinite number. It'd be great for everybody to have laptops, but we're just not in that position. Look, it's nearly 12 o'clock. I suggest we take a break now for coffee, if everybody's in agreement. Colin, yes?
Chair, could I just say I need to go due to a personal appointment at midday, and we're there now. I will try and get back as soon as I can from it. We've only covered item 1, but Rob England, Wendy Williams, and Charlotte are all here, and any one of them is good enough cover for me and more. So for the papers that I have my name against, I'm sure between them they can cover and field the questions, but I'll be back as soon as I can. The only one that I was down to cover individually was the performance report, which is a standard report that you get every time we meet, and Rob is on the line, and he'll certainly be able to give you answers to any questions you might have in relation to the performance report. And Wendy also is on the line. You did ask for an update on Travone House,
yes,
Andrew, and Wendy's here and able to give you that if members want that update as well.
Okay.
Okay. So if you'll excuse me for the time being, and I'll sign off. Thank you.
Well, thanks very much for that, Chris. So what I suggest,
Andrew,
Colin,
just
yes.
there's 2 quick things. One, on a number of occasions when somebody's been dialing in on one of these meetings from Shire Hall, there's been technical issues, and I would have thought that was the place where you'd least expect that. And I do think that if that happens, we do need to have be able to test it before someone enters a meeting. I think it's particularly unfortunate that Tamara should have suffered that today. The second thing is there's a number of issues that have been raised today which I do think need forwarding either to the LGA in terms of I can't remember their title now, but Leslie's a member, the children's whatever they are. And I do think that in some cases these need to be passed on directly to government because they're really important, and clearly we're not alone, but clearly they need to know that scrutiny committees and members feel that actually they do need to improve their communications, the way in which they pass stuff out. We can't do that now, but I'm sure you would be able to put something together to actually forward that on, because this does need to be recorded and sent to the right people.
Right.
Okay. I'm more than happy to take that on if somebody gives me a briefing note about it.
Okay. I think I'll need to talk to Richard about that. Richard's on the line. I think Richard also in the chat has mentioned that we did do some testing with Tamara's laptop, so I don't know why it hasn't worked, but there was some testing done before we started the meeting, but clearly it hasn't. It's clear it's gone wrong, so I don't know why that is. I'll take that with Andrea and perhaps with the council's IT afterwards, if that's okay with everybody.
Can I, Andrew, before we break, and then thank you for letting me butt in. It's a long agenda ahead of us.
Yeah.
And if we're to do any of these items justice, we're going to be here for quite some time. And I wondered if there was any way around it. But it's where are we? It is just 12 o'clock, and we've got a work planning session as well. It does seem to me that it's really ambitious to think we're going to get the rest of this stuff done, say, in the next hour and a half.
Yeah, I agree, Leslie. I think, but I think this issue is one that members felt very strongly about. That's very much the impression I got. So, yeah, it's been a long time. We've taken 2 hours, but I feel there was a lot of concern about
really
it.
Important. Yeah, no, yeah. I think it was right.
So I think what we need to do is be very strict with ourselves for the rest of the agenda to move through that as rapidly as possible. but still to spend a decent 10, 15 minutes, maybe more, on the work programme, because I regard that as being very, very important too. So what I suggest, with no more ado, can we be back for 10
Sorry,
past?
before you go, Chair, there is one other alternative, because obviously you haven't looked at the disabled children for quite some time, and I'm pretty sure that you're going to want to look at that in great detail. So the only other alternative, and this is obviously totally up to members, is if I try and identify a date this month for us all to reconvene and have an extra meeting to just go through all of the performance data. Anyway, something to think about when we're on a break. I just thought I'd throw it out there before we all had a pause.
Okay, so what we'll do is let's have a break. Let's come back at 10 past 12, and I'll take some sounding from members about whether or not we would like an additional meeting after the break, if that's all right. If that's okay with me, yeah, I think that's gone down well. Cool, good. So go and get your coffees.
So hi, I'm Tamara and I'm one of the ambassadors. Some questions.
Andrea, can I just check if you can hear me? It's Rob England.
I can hear you.
Oh, yes. Sorry, Andrea. I was after Andrea.
Oh, sorry.
Our host. Sorry. Andrea, could you check your email from me? I've just dropped you an email. Okay, super. Thank you.
Okay, it's 10 past. By the looks of the videos, I don't think we have everybody back. Ah, okay. And Colin and Leslie, I don't think are back.
Andrew, can I just say that I'm going to have to go at around about 20 to 1 because I've got a meeting at 1:45. Okay, so I'll just quietly locate at that point.
I think Chris Coleman just reports that he has.
Hello, Charlotte Jones.
Hi.
Hello.
Hello.
Oh, hello. Yes, I was on mute. Story of my life.
Okay. Sorry, who is that? I can't see the, I can't see who that was.
Sorry, it was Charlotte Blanche who's going to lope out a little bit early at 20 to 1.
Yes, Chris Coleman has to go at 12:30. Can I have some some views around whether or not we should have a second meeting this month? Can I get given the size of the agenda today?
This Brian, yeah, I think we should have a second meeting because I don't think we're going to get through the rest of this agenda and do it justice.
Right. Okay.
Agreed.
Yeah, I think that's
And I'm going to have to go at 12:30.
right. Okay. So look, Andrea, I think we've got a very clear consensus here that we would like an additional meeting this month to consider anything that we've not been able, essentially as an overspill for today's meeting. Okay, cool, good. Without further ado, can I hand over to Sue Hall? That's as opposed to Suzanne Hall. They are two separate people. And Sue Hall is going to present to us on a progress report on the improvement plan for disabled children. Okay.
Chair, Rob England here. Sorry to interrupt as we move on. I just wanted to share that we have Tamara. She's come and joined on my computer as I'm in Shire Hall. So if anyone would like to direct anything to Tamara, please feel free to do so. She's now joined us.
Great. Tamara, can you introduce yourself to us?
Yeah, hi. So I'm Tamara, and I'm one of the ambassadors. What else do I know, really?
That's great.
Welcome.
Thank you.
I've been pushing to have ambassadors in our meetings, Tamara, because what I want for these scrutiny meetings is for us to get the widest possible view on children's services. And if we don't have a view from the ambassadors, then we are impoverished if we don't do that, Tamara. So I'm sorry that we will probably have to overspill to another meeting date. So if you're able to come back to the follow-up meeting, that would be great. We would particularly like your views on the work plan to know what you think we should be focusing on. But I'm afraid that we're going to have a second meeting this month in order to be able to cover everything. But thank you for coming. So Sue, back to you.
Hi, thank you, Chair. So what I'm going to do is I'm just going to go through the highlights really. You've had the improvement plan that we have drawn up for the whole of the service, and service obviously includes the early help service, our family service and the safeguarding service. We're very aware that the spotlight's very much on the safeguarding area of the service, so that's what really I'm going to concentrate on today. As Charlotte has quite rightly said, the challenges of COVID have been quite significant within the service. We support some very, very vulnerable children, and their vulnerability really has had quite an impact on parents' ability really to continue to support. Some families have felt unable to access some of the short breaks that they would normally access, just due to their worries and concern about their children, which you would expect in these circumstances. So we've had to be quite flexible on how we've supported people and families within the COVID arena at the moment. Some families have chosen not to take their direct payment workers. We've found that we've supported families to buy different kinds of equipment at home that children are more settled to play with, and therefore they're getting a shorter break away from the child with garden equipment. We've had hanging pods. We've had all kinds of sensory equipment that we've purchased during these times to try and be really flexible and creative around families getting the support they need. So it's been quite challenging times. We've done risk assessments on all of our children. We do regular phone calls to families so that they don't feel isolated in these times, although obviously they are, and it's quite challenging. We've also joined up with a carers hub to ensure that the carers hub is able to do phone rounds to families and continue to liaise with our schools. Some of our most vulnerable children we've been able to still get sometimes in schools with them. They might be on a part-time timetable, and for some families that's made a real difference. So it's just to put some context really about what it feels like for our families. The workers have been really resilient, I have to say. I'm very kind of proud of the work that the safeguarding team and the whole of the service has done really to maintain families during this really tricky time. We've had very low staff sickness, and we've been, as we all are, I think, learning to use technology more effectively to create those contact times with children. So a lot of our contact times, instead of going out to visit where it might be a bit more risky for that particular child, and we have been using technology, WhatsApp, all kinds, really, whereby children, we can see children, we can talk to families, and we can still have that contact. Some of the children have absolutely loved it. They've enjoyed very much having that screen contact. And some of our staff have dressed up in costumes, sang songs, and I've seen some absolutely fantastic work going on, some real creative, flexible working to really engage with our children, really, and to get a feel of how they're doing and what their lives are. So that's just some context around it. The implementation plan you've obviously all seen. It's quite a beast, it's quite extensive, as it needs to be. It's quite detailed in the areas, and to be fair, we will be adding to it as we go along. When we manage to achieve some areas, we'll be adding to other areas that as we go. You will see that there has been a little delay in some of the areas with liaising with our health colleagues in particular, and obviously this is around government guidance. We haven't been able to have those that input and that impact really. I'm envisaging that as we're coming out of our lockdown and into what we're calling the new normal, that will then speed up really. We've seen some of those actions taking place at the moment. The majority of the actions on the action plan are underway. With all of these things, it takes time to embed good practice. It's not something that we can just tick a box on and then ensure that actually we've done that. We can't take our eyes off the ball off of any of it. There's been some very good work going on around the implementation of the performance that we're now getting through much more effectively. So every week, social workers will have their own individual performance sent through to them by their managers so that they can see where their pressures are. This also should come through to them on the Liquid Logic system that we use. They will have their own work tray, and this has key areas and deadlines in it. So we are finding that people are using the performance a lot more effectively. It's really embedding in practice across the service. We're working on performance within the family link area and within the early help, which are a little bit behind the safeguarding area. And this is predominantly as those reports are being built, what we're requesting, what our performance team are putting together and then coming back to us. The team managers will all meet weekly with the service manager and myself when I can get there, to really look at overall the themes that are coming through, the particular areas, the deep dive audits that we do monthly, but also the dip sampling audits that we do to ensure that those practice fundamentals are really being ingrained within our practice, and that we're seeing the evidence come through on the case files, on the management oversight. Supervisions have increased, so our percentage of supervisions on file is looking a lot more healthy. We still have a way to go, but to be fair, we have a new manager who started just over a month ago. Our previous team manager left quite suddenly. Our new manager, I have to say, she's got a huge amount of experience and has just been through Reading and the journey that they've been in through to come out of their Ofsted inspection. So I'm very confident that where we're going now is a very healthy place. We've got a number of new team members, and whilst that previously I think has been an area of concern, the positive thing about that is they are all bar one permanent members of staff. So this is exactly what we want to see in the team. This is how we create changes of cultures. And this is how we are able to move forward. We don't have the instability of agency staff who we've been very fortunate with to a certain point in the past, but permanent workers is always much better for our families. They're not going to be having changes as social worker. They're not going to have to be retelling their stories. So that's a really positive area. I think the stability of the staff also then moves on to how we can embed and motivate and have aspirations for our children. We've been able to really do some really good reflective supervisions and reflect back on particular cases. We've looked at themes going through cases. We've looked at the reflective learning of where have we got to now? What do our audits tell us? What does our chronology tell us? What are our children telling us? So the engagement that we're getting with families is much better, and we're seeing a decrease in some of the complaints that were previously coming through about changes of social workers. So that's quite positive. We still have some very big areas of development within the service. We've got a new positive behaviour support service that's just coming online. It's really exciting, actually. We have a contract with Affinity. They're recruiting at the moment. And the purpose of the positive behaviour support is to work with our children that are right on the edge of care. They're very complex cases. They often have quite challenging behaviour that would challenge a lot of the services that are working with them. Our CAMS colleagues are working with them. So this service is to support one individual child per worker. They will work with that child. They'll have 30 hours contact a week. And to give an idea of it, they will essentially spend some time observing, assessing, doing some behavioural analysis, then write up some behavioural plans, and go in to support families and mentor that positive behaviour and support families to learn and to build their own skills within the family home. But they'll also be working within schools, within our respite unit, to really embed a change of behaviour so that we can support children to remain at home and not necessarily have that trajectory of coming into a longer term care, which we know the outcomes are not as good as if they were to stay at home. And often, because our children are so complex and very specialist in their own needs and specific, these environments that they then are being placed in, so often residential schools, are significant away from Gloucestershire as well. So the impact of that is families are having to travel, social workers are having to travel, children are displaced from their local communities, which is not really what we want. And we want them to stay in their local communities, to still have that friendship group, that environment that they're used to, because as young adults, they will be coming back into the So I'm really pleased to see that this is a service that is, as I say, about to start. We're hoping that we're going to start to work with our new cohort of probably 4 children to start with in October. But as I say, these are our most complex children. The other area that I think is probably an area of concern really is our transitions area. Again, we're doing a lot of work in transitions. We're linking up very closely with Wendy Williams in commissioning, and we have a transition strategy that is currently in draft that is being shared with our adult colleagues. So we do have some movement in there, but it's a very big area of improvement. So it's going to take longer to see the real impact of what we want within this service. But nevertheless, we are making progress on that. We've reviewed the transition panel that we have at the moment, where we collect the pipeline data of all the young people that are coming through into transitions and the types of service that they might need. We have the right colleagues around the table now, and there's a lot more effective decision making going on. But I am aware that we are not working quickly enough with these young people and not in a timely enough manner. So often the transition planning isn't starting until they are 17 and a half. And obviously we would want that to be at a much earlier stage. So we're working with our colleagues to ensure that we can pick that up and we can have better outcomes for those families. I think that's probably it for the moment. I'm conscious that we are somewhat tight for time, but I do welcome lots of questions, because I think actually, instead of me sat up here talking extensively, I know you've got a lot of information in front of you that I've already sent you. I'd much prefer to kind of take questions and be able to answer what your queries, worries, celebrations are.
You see, I don't have any formal hands raised in the chat. So if you want to speak, can you
hands up, Chair.
Your hands up? Yeah. Just say, so we had the Care Leaver Services Plan 1920 sent out with the agenda papers inadvertently. I wonder if it was something else that was intended to have been sent out instead, which wasn't there. Can I just check that?
Yes, you should have had the Disabled Children Young People's Implementation Action Plan.
Right, which I don't think we got. We got a different action plan instead.
Okay.
People won't have had that to refer to. I wonder if between you and Andrea, you could arrange for that to be sent out to members.
Yes.
If that would be okay. So that's my main point. I'm just going to check if we've got any hands up. I can't see any hands.
Chair, I've got my hand up. I think I raised my hand.
Oh, okay.
My hand up as well, Chair.
Okay. It didn't come through as hands up, but I will take those. Is there anybody else? I've got Colin and Brian in that order. Anybody else? No. Okay. Well, over to you then, Colin.
Okay. First of all, can I say that the plan that you have is really good, and I think there's some exciting things in there. And in what I'm going to ask, I don't want to detract from that at all. I think it's all moving in the right direction, and you said you were excited about the one-to-one work, and I can well see that. That's excellent. But what I do want to ask, which is perhaps a more difficult one, and maybe one for Richard or Wendy, as Chris isn't here. The fact that, nearly 2 years on, this is seen as a service that wasn't performing as well as it should do, I think raises some really quite searching questions for all of us. That, you know, it took a kind of concentrated look by Ofsted to draw out these issues, and there really is a
Colin, we've lost you. I think your connection's gone down. I think we've lost Colin. Brian, can I bring you in?
I've stopped now.
Oh, okay. Colin, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes, I can.
Okay.
You've stopped your video, which I imagine has given you more bandwidth.
Yeah. Yeah.
Okay.
I don't know how far I got, but you know, it may be a question for Richard and or Wendy or whoever. The fact that the whole of Children's Services has been under a spotlight since Ofsted's visit, yet 2 years on a concentrated visit from Ofsted on Children's Services for Disabled, it came up with some being quite critical, and you wonder how that came about. And I think that's a deeper question to ask, and I don't think it was fully addressed the last time. And when we had the report from the chair of the Improvement Board, and I do think we need to look at that and maybe have some answers.
Sue?
Yeah, I think that's a fair comment, actually. Personally, I've only been in Gloucester since the end of January, so I'm not really able to understand the journey to the point prior to me coming. I think I'm not sure if one of my colleagues online will be able to do that. But what I will highlight is that I think, you know, when Ofsted came and visited, we on our recent visit, we did get some really good verbal feedback, and we were very surprised when the letter came through that didn't reflect what they'd actually said to us. So we did take some learning from that, and we've reflected and we've looked at what it is that they raised. They were with us for quite a short period of time, literally about 3 hours. So I don't think it's necessarily a complete reflection on everything that's going on in the service, but I do acknowledge what they do pick up. We still have got some significant areas of improvement.
Well, thank you for that. Can I come on to you, Brian, please?
Yes, thank you, Chair. Yeah, I think my observation listening to this is clearly that the sort of staffing challenges that across all of children's services clearly apply here too. Listening to it, it feels like a bit of a haphazard journey of people leaving and that. But it does look like opportunities have been taken to strengthen it. So the fact that we've now got, I think, almost a full-time workforce sounds actually very positive, and probably we need to take that out of it. But the thing that came across to me is the fact that the transition, you said earlier, I think sometimes doesn't start till 17 and a half. We've looked at transitions across this children's services in the past, and my understanding is, and I say in the past, in previous sort of council terms as well, my understanding is that we should be looking at this from about the age of 14, so that there's a long period of understanding the children's long-term needs, and for children with disabilities, that must be vitally important. And I would have thought for parents, one of the biggest questions has got to be, how is the transition to adult life managed, because they have to accept that their role is not forever. So and that must be one of their biggest concerns, is how that transition goes. So the fact that I've actually come across situations where parents have said to me, you know, my child has left school in July, and I don't know what's happening in September because they don't know what the transition plan is. I think that's quite shocking, and that was something that was said to me some years ago. So it does concern me that we still have a situation where some children, at least, don't have this transition pathway properly mapped out, because it's not something we don't know is coming. If we're looking after children in care with disabilities, we ought to be thinking ahead in helping parents and the child to get to a future adult life that's supported and has the ability to meet their ambitions in life, not just their care. And so, whilst I'm pleased to see that progress is being made, that one to me jumps out as something that we ought to have been looking at much more closely. And the other point I would just like to pick up is that whilst this is a good report that tells us quite a lot is going on, what I don't feel we've got is the voice of the parents or the children. And I'd like to find a way for us at Scrutiny to actually hear some direct viewpoints from parents or children. I don't know if that could be for some of them to actually talk to us directly, or for a survey or other things. But I'd like to get feedback direct to know that we are delivering and at least addressing the main concerns that they might have. Thank you.
Yeah, thank you.
Brian, if you could respond to those points too, but just to come, Brian, I think a very good point about listening to the views of parents and children. As I said earlier, one of the things I want to do is to widen the scope of the voices that get heard on this committee, and that very much chimes with that theme. So I don't know if Sue can work with Andrea later to see how we could work that into our work programme or for a future committee meeting.
Yeah, absolutely. Yeah, your point about transitions being timely and families, children understanding the plan for them. I mean, workers, we do start conversations about transitions very early with families, and actually earlier than 14, because you know, often we say to families, you know, where do you envisage your young person being as a young adult? What are your aspirations for them? What would you like them to be able to do? And we have the similar conversations with those children much younger than 14, because I think, you know, as anything, it's a bit of a journey with a lot of our families. You know, they're struggling with a diagnosis, they're grieving themselves, and it's a journey that they're going through. So we do have conversations very early on, even pre-14, and start helping families to kind of hone in their ideas, to have those aspirations, because the care plans that we're working with young children are something that, you know, building on their independent skills, building on their communication, all lead on to that, you know, their adult life, really. The transitions panel itself does collate all the pipeline data. So we know the children that are coming through, as you said, and we do start the conversations. We do start the assessments that take place within the safeguarding team. They're all geared towards the increase of skills, aiming towards where a young person needs to be as a young adult. The areas that are a bit slower are often about finding the most appropriate resource, placement, accommodation for those children, and that's the bit that we need to get better at. Absolutely. We do know that you know, we do go out to providers, but often places become available at specific times. So you could have a transition plan, and you can have everything in place at 16 with the plan. But actually finding the placement, the provider to support that child isn't going to happen until near their 18th birthday, because obviously it's about availability, places becoming available, providers going out to assess, and then that kind of the movement from wherever they are at that current time to that new setting. Sometimes this is around accommodation, sometimes it's around school. But I do hear what you say, Brian, and I agree. I think, you know, we do need to get better at working with that in a multi-agency way to be able to identify a much sooner time. So parents aren't, as you say, in July wondering what's going to go on in September. We have less and less of that happening now. We're getting much better at it, but by no means we're at that finishing line yet. So I do take that on. The voice of parents and children. I work very closely with the Parent Carer Forum. I regularly liaise with them. We have catch-ups. We have done all through COVID. We do have surveys that go out to try and capture the parents' voice and what they're telling us and the feedback that we have. So that's really important to us. We're working more and more. We've had, I've ensured that parents have been on interview panels lately when we've been interviewing staff. I've ensured that children have also been on those interview panels in the way that they can. They've had questions that they've wanted to ask candidates, and they've scored those candidates themselves with, you know, levels of smiley faces depending on what the child's ability is. So personally, I'm very much about bringing children, young people, their voice, their experience into the service. I'm working with Parent Care Forum at the moment to see if we can pull some training sessions together where parents come in and they tell social workers exactly what it's like and what's their lived experience of having a social worker in their house, of having to share their story, of having been assessed, so that we can take on that learning to really understand and embed our practice on how we can engage in a much more meaningful and respectful way with our families and really work together. So I do take on your point, and I do think that we should be able to get the voice of parents at this meeting.
Thank you very much.
That's very helpful
for that, Sue. If you've got any survey material that you are able to share with the committee, that would be great when you send out the disabled children's plan. But it would be good to actually hear ourselves from some parents and children at the committee at a future point in time.
Chair, sorry, it's Wendy. Can I just offer, would you like also to have circulated the draft? It's not called a transition strategy, it's moving on to adulthood. We do have that draft ready, it's out with our partners at the moment. Just on that around transition, I think we've got to be very clear, it's around a whole system change. So it's our partners in adult services as well, who have jointly worked on the document. It's really important that we start planning for our children from the age of 14, but we have to do that across the board. And also within the way we're looking at commissioning is to actually build resources in county for our young people as early as possible. But some of the biggest challenges when they're put out of county to bring them back in. So we've got a couple of pilots going at the moment to build lifelong homes for young people in county, which will transition with them into adulthood. So that's quite innovative and very different. And I think the PBS also, the Positive Behaviour Service, links into that. And we're building some respite facilities within county for those young people. So to keep them in county, local, in their local connections and communities is one of our key priorities. Can I also just say that COVID-19 has impacted on young people transitioning. There is a huge demand on adult services. There is a lack of capacity to move people around, especially people with complex health conditions because of the risk of infection. So we do have a small cohort of young people within Sue's area, but we also have a cohort of care leavers who have remained in children's services provision post-18, and that is due to the impacts of COVID. But is that okay? I'll liaise with Andrew if you're all right to put the document out to be shared.
Thank you, Wendy. I've got, I think Colin wants to come back. I'd also like you, Wendy, if you could give a very short verbal update on Trevone House. I know it's only vaguely related to the agenda, but I think most members would be interested in that. And I think we're probably going to have to call this the last agenda item, given that it's coming up for 1 o'clock and we're planning an overspill meeting.
Okay, so shall I do Trevone House then? Is that helpful?
And then I'll bring Colin in.
Oh, lovely. All right. Sorry, Colin. Do you want to go first, Colin, or you're right? No.
Yeah, if that's handy. Can you hear me all right, by the way? I've got the video on.
Yeah, no, we can hear you.
I wanted to come back on this question, and I know that it was difficult for Sue to answer because she's relatively new. But just to repeat, Chris is here now. The fact that 2 years on, or nearly 4 years on from the Ofsted, 2.5, you know, a service is seen as being not great, let's say, in this Ofsted letter. And I do take the point that they weren't here for very long, and Chris certainly challenged the letter compared to the verbal feedback. But one of the things we've heard is that that service had a lot of turnaround of staff, and maybe it's a failure on our part as well. We should be looking at those areas where potentially there may be some concern. And the report, as I said earlier, is very good in terms of moving forward. But we do have to ask ourselves the question, why was a service found to be, I'm trying not to use the word inadequate or any of the Ofsted terms, but not so good, so late on? And if that was a reason that there was a big staff turnover, we should have noticed that. And so maybe we need to be looking at not just the staff turnover overall, but in specific teams. And I do think it deserves an answer as to why it was missed, why we weren't concentrating on this at an earlier stage.
So, Chair, can I take that? It's Chris. I have returned, as Colin said. I mean, first of all, it wasn't missed. And you've heard me say that before. We knew that this service was underperforming. In fact, we directed Ofsted to that service because we have a policy of directing Ofsted to the weakest link, because we have an approach which is you're only as strong as your weakest link. So we wanted, in a sense, our view of the service as struggling confirmed, and we wanted to be able to present our plan to Ofsted for its improvement. There had been a lot of staff turnover, and we are addressing that. When I arrived 2.5 years ago, we had 257 agency staff. It's now down to 97. All the pipelines that we put in place and the academy that we created to support those pipelines is working well. You can't create a workforce overnight. I said when I arrived it would take 2 to 2.5 years to stabilise the workforce. And until you stabilise that workforce, you can't land the improvements. The other major change we've had is, of course, we've completely changed the senior leadership of that service as well. And again, people like Sue need time to embed those changes. God, it's like working at Clacton Peary. I've got my front door going now. But I think that kind of answers it to a certain extent. We are aware of it. We were aware of it. We told Ofsted of the weaknesses, and we had a plan in place to fix it. It's far more worrying circumstances where they find something that we're not aware of, and they haven't done that just yet. I just need to let my son in, excuse me.
Thanks, Chris. I think that was a really important point. Richard Castle had a procedural point he wanted to raise. Williams has to go at 1 o'clock, but maybe that Chris gives the update on Trevone House rather than Wendy. Wendy, do feel free to go when you need to. Richard.
Yeah, I'm really grateful for this, and you're probably not going to like it. I honestly don't think we can sit down as a scrutiny committee and say we have looked properly at this agenda item, particularly without the implementation plan or anything like that. In view of the fact we're going to have another meeting, I really would like, I mean, it's a hugely important subject, particularly for those involved in it. And I would like to suggest that we actually just take this forward, cut the discussion on this now, take it forward to the next meeting and just pick up from where we left off rather than Sue needing to repeat everything she's already said and written. I don't think we've scrutinised it.
Yes, and in view of the fact we didn't have the right agenda paper support, I've got some sympathy for that point of view. Sue, would you be able to come back to the next meeting?
Yeah, absolutely, no problem.
Okay, and we can have the right agenda, the actual right agenda papers in front of us for that meeting. Good. Chris, I think either you or Wendy, but Wendy has to go soon. Very quick update on Trevone House, and then I'm going to call the meeting a close, and we'll take the remaining, second bite at this agenda item and the remaining items at our next meeting.
So shall I do this then quickly? So I'm sure most of you know Trevone House has been converted from a 40-bed older people's home to offer sort of 19 beds for young people and 2 wellbeing flats for young people coming out of mental health establishments. It's predominantly for young people, so they're 16 to 25, and they can stay either in Trevone or connected to Trevone for that period of time. We're really successful and really happy to have awarded the contract to Homes to Inspire, which are one of the largest residential providers in the country. So they have a very good and strong reputation, but they are a charitable and not-for-profit organisation, so they're not one of the big profit builders. But they're very experienced and bring a very good level of professionalism. That we signed the building over to them on the 1st or 2nd, I think it was, of September. And we're just doing all the fit out costs at the moment. And I'm leaving at 1 o'clock so that I can join the interviews for the director post of Trevone itself. So their recruitment has been very strong. They have appointed quite a number of posts at the moment. They've done a recruitment campaign out to our care leavers and our care leaving service to encourage care experienced young people to work at Trevone, and we have at least one young person who's in our foster care who has got a job already and is working at Trevone House. We are working on a trauma-informed model, and we're linking up with Dr. Anna Draper from the Tavistock around the training to embed a trauma-informed model of care for our young people. We have 7 young people lined up to move in, and they will be moving in sort of mid-November at this moment in time. So they should all be in place before Christmas. Some of those are our most complex young people. And some of them are in prison, and they know that they're coming out to Trevone and are feeling very excited about that. We're doing virtual tours of the flats, so they all go out to the young people so they know where they're going to live. There'll be further young people coming in January, and we hope that by around April we'll have around 13 young people in placement. It will take time to put them in. We are working with the police who are in partnership with us. There is a PACE bed there for young people being transferred so they're not in custody. But we're also setting up the protocols for a place of calm, so young people will be held at Trevone House rather than in custody or elsewhere. And there is an educare model, so they will support young people in crisis out of hours, not just the young people that live there, but that would be through EDT. So at the moment, it's in a good position. It has been slightly delayed due to COVID, but I think we've overcome that now. And yeah, we're fitting out the building and we're getting the staff and training in place.
Question for me, Wendy. Best estimate at opening date?
We hope that the young people will move in sort of mid-November. If people are keen to come and look at Travone, which they're very welcome to do, and meet the staff team, in some ways we're quite keen to do that before young people move in. We don't want to create a sort of goldfish bowl effect, that we come and look at their flats, as it were. But if people are interested, and if you want to liaise, if Andrea liaises with Alice, we can set something up. This has been co-produced with young people. So there are young ambassadors that have helped design Travone who can be there to talk to you about the experience. And we've also got a couple of young people. One young person is now employed there, another person who looks like is going to get employment there, who will be able to tell you about what it's been like in designing and working at Travone. So you will get some care experienced young people. They just won't be the young people that are living there. We don't want to create a goldfish bowl effect, if that makes sense.
Understand that, Wendy, and I think members of the committee, including those that have had to leave, would probably be interested. I would certainly be very interested in that. So yes, if you can liaise with Andrea, that would be absolutely fantastic. Can I say thanks very much for your hard work on that? In fact, can I thank the other officers who've been here today to present to us? I think it's time to call the meeting to a close. A number of people have left already, and Wendy is about to leave. So thank you very much for coming today, and Andrea will be in touch. Thank you.